I'm Dr. Danyo, Medical Director and founder of North Atlanta Hair Restoration here in Alpharetta, Georgia. We're about 30 minutes north of Atlanta. I started North Atlanta Hair Restoration about 4.5 years ago. I have a background in pain management and physical medicine, and I've done thousands of spinal injections on my patients as well. I'm certified in acupuncture. And my office manager says that I was born with a needle. So my transition into hair restoration was natural for me. Yeah, I was inspired to go into hair restoration in an attempt to better my patients. I also at the same time was considering hair transplantation for myself, which I had just prior to starting this practice. And it was going through the process of actually getting it done that spurred my interest to actually learn it and become an expert. It then became my passion to be the best and really be patient focused as I was with my previous practice in pain management, physical medicine and rehab, and to create an environment that was totally patient focused and really boutique. What we're doing here at North Atlanta Hair Restoration is unique. I'm one of the only doctors in this country that actually performs the entire procedure essentially by myself for hair transplantation. I do all of the extractions and I do all of the placement. The recent addition of SmartGraft has just been an incredible instrument and tool for me to provide even a greater service. It allows me as the physician, as I'm grafting, to get positive feedback to say I'm at the right depth, we're getting great grafts, and it ultimately provides the best results. What is the actual cause for the hair loss, whether it's medical or genetic? The medical issues that are more acute include thyroid problems, anemia, hormonal imbalance, stress. There may have been a recent surgery or event medically that is putting stress on the hair to either fall out or actually shrink and miniaturize. And it takes a physician to really get in there and determine what the issues are. The second aspect of the medical workup, especially in women, is to determine, is this a female patterned hair loss or not? And for the guys, is it a male pattern hair loss or not? Because the other category for alopecia is something called cicatricial alopecia, which is a fancy name for an inflammatory cause for the hair loss, which can be devastating. The cicatricial alopecias are not necessarily amenable to hair transplant or to traditional hair restoration techniques that we use in this practice, and they require more of a medical approach with medications, possible biopsies, and it's up to me as a physician to make those appropriate referrals to physicians that specialize in that part of hair loss. In determining candidates for either non-surgical means for hair restoration or surgical means, it is important to do an in-depth medical evaluation, history taking, determine the actual family history to determine if there's a genetic component, rule out inflammatory causes for hair loss, and then do a follicle analysis. And what the follicle analysis does is determines the amount of density loss, meaning actual hairs that are not present, and also determines how much miniaturization or shrinkage of the actual hair shafts. So when we talk about medical management, we're generally talking about people that have lost hair volume related to the shaft of the hairs actually shrinking and miniaturizing in width. And treatments that we do here include platelet-rich plasma injection therapy with or without a medication called ACell by Metristem. Medical management relates to possible medication use either with oral medications such as Propecia, also known as finasteride, which is the generic, or topical agents, and we have topical agents that we have in the office that patients can purchase to help thicken and revitalize the hair. The Propecia and finasteride has some issues related to sexual dysfunction, which are still being determined as far as to what extent, but it is reported, although likely very rare. But we do use Propecia and finasteride frequently for our patients who request it, and that is the only means to actually block the main genetic reason for your hair loss. It actually blocks the conversion of testosterone to dihydrotestosterone, and it's the dihydrotestosterone which is actually hurting the hairs and eventually killing them, leading to baldness. Recovery phase for what we do here at North Atlanta Hair Restoration is different than other practices. My focus is to create a minimally invasive procedure with the follicular unit extraction, but then also make it virtually concealable. We do multiple things to make this happen. First, we most commonly perform what's called a shaveless FUE technique, where we individually cut the hairs that are going to be grafted and we leave all the other hairs in the donor area, which are on the side and back of the head, alone. And SmartGraft allows me to easily core, pull, and store those hairs quickly, leaving the other hairs. So when people leave after the procedure, you cannot tell that I did hair transplant from the back of the head. Our approach is unique. It's unique in that I, as a doctor, am doing all of the extractions. I'm using small punches to take partial follicle grafts of large groupings to maintain the donor site, to create a more natural look, which is not plug-like in character. I'm using implanter pens to give maximal density, minimal swelling, quick recovery. And we're also including medications like hypothermosol and ATP to make the recovery process and the actual results the best they can be. Candidates for FUE hair transplantation are really people that we've evaluated and found that they have a density loss. Now, the density loss could be just a forehead that is going back, or a crown, which is the top of the head expanding out, but there needs to be actual hair loss. We generally do not do FUE, or I don't recommend FUE, if there's not hair loss and there's just hair volume loss related to miniaturization. So some people will do small FUE cases where we're just filling in, say, a temporal peak that's too high. Here they want it down a little bit more, or bringing at the sides forward. Or there may be people that are completely bald, and it takes multiple cases to build up a hair pattern, including the frontal hairline, the middle part of the scalp, and then also the crown. SmartGraft is really an amazing device. It allows me to core, pull, and store the hairs all in one motion. And that's essentially knocking out 2 extra steps compared to conventional FUE techniques. The conventional FUE technique is to actually core the hair and then later come back and pull the hair. And when you're doing particularly a large case, speed is very important, because the faster you get the hairs out, the quicker they go back in. And if the hairs go back in quicker, the survival rate and actually the recovery rate is much better. So what SmartGraft allows me to do is cut the time of extraction either in half or even into 2/3 compared to previous techniques. At North Atlanta Hair Restoration, we specialize in a technique that only about 10% of doctors are actually doing right now routinely in their practice. I actually do it on more than 60% of my FUE patients, and that's called a shaveless FUE technique. Now, generally with FUE, to harvest the hair, you have to cut the hair down to a zero guard, which means just above the skin. And when somebody's head is shaved, it's very easy to quickly graft the hair and then quickly place. But that's not something that most people can actually do. Take a businessman, for instance, who is meeting with board members or meeting with clients or traveling, who generally has longer hair and now has to deal with a shaved head and recover over sometimes 2 or 3 weeks to get past the procedure. The shaveless FUE allows me as the surgeon to leave the hairs that I'm not going to be grafting in place at the same length, and then we individually cut those grafted hairs, or hairs to be grafted, with a pair of fine scissors, and then we extract those small hairs. So when people leave, there's virtually no evidence that I actually even did a hair transplant case. I've done over 3,000 grafts over a 2-day period, and I've had people go back to work the next day with this technique.